I'm Dr. Priyanka Mehta, obstetrician and gynecologist through Diva Women's Center, Chennai. The moment the pregnancy test becomes positive, even before the first scan, the thoughts that run through a couple who are expecting their baby is whether she's going to have a normal labor, a vaginal birth, normal delivery, caesarean section, C-section, CS, and so many other confusing terms which you have been hearing all along, either from your friends or from your relatives or from your mom and so many people. So first, let us get the terminology correct. Pregnancy is 40 weeks, which means 280 days from the first day of your last menstrual period. Pregnancy is 40 weeks, and that is why we divide it into 3 trimesters. The first 3 trimester is the first 12 weeks. From 12 to 28 is the second trimester. From 28 weeks onwards up to 40 or 41 or 42 weeks becomes the third trimester. Now, as you're approaching your expected date of delivery, you start worrying and you start wondering whether you're going to have a vaginal birth or a caesarean section. I think we should start using these terms rather than using the term normal delivery, because I think delivery is for pizzas. So vaginal birth is when you're going to birth through the vaginal birth canal. C-section or caesarean section is when a cut is made on your tummy and baby is delivered through that process. Now let us talk about vaginal birth first. I am not here to tell you which is better. We always try for a vaginal birth, and if there is a problem and a vaginal birth is not happening or it is dangerous for mother and baby, then we have to opt for a caesarean section. So for a vaginal birth, there are certain things that you have to start doing not at the time of labor or at the time of birth, but from the very beginning of pregnancy itself. So I'm going to give you 4 or 5 tips which you can remember and you can practice these throughout your pregnancy, so that in the hope that we have a happy vaginal birth. The first thing is, ask yourself, what is it that you want vaginal birth? Why do you want it? And also you have to believe that you can have a vaginal birth, because many young girls have the fear of pain and they wonder whether they will be able to undergo this vaginal birth. So the first important thing is that you start believing in yourself and start telling yourself from the beginning that my body will be able to do this and I will have a vaginal birth. We are not talking about what the outcome is going to be, but at least by telling yourself this, your body is going to follow what your mind is saying. The second important point is you should have a birth plan. A birth plan means you have to understand what happens during the process of birth, and in the following videos I will be talking about what are the phases of labor and what exactly happens in pregnancy, in each week, in different trimesters, and how the labor pain starts and what you have to do during labor and after that. So you have to understand that the birth plan should include what is it that you would want during your labor time, who should be with you in the labor time, what interventions you would want to have and what you don't want to have, what kind of position. And there are so many other things which we would also be discussing in a separate video about birth plan. The third important thing is the birth team. So your team is so important. Even for a sports event, or when you would have had a cultural event in your school or college, I'm sure you would have had a team who would be encouraging you and who would be supporting you. So having a team and having a birth partner, in fact, is so important, who is going to be supporting you throughout your labor, birth and beyond process, and is going to be there so that you feel supported and you don't feel alone that okay, I have to go through this on my own and there is nobody to help. So have a very positive and very encouraging birth team ready with you. Positive birth stories. I can definitely vouch for this. When you are filled with different kind of positive birth stories, see, birth is unique. Birth and pregnancy sometimes is unplanned. We may not be able to plan everything. But if you keep listening to a lot of negative birth stories and somebody had this problem and that problem in labor, your mind is just going to keep thinking about what you don't want and what can go wrong and this and that. So instead of telling that I don't want a caesarean section, I don't want an epidural, I don't want this, keep telling yourself what you want. So that as you keep listening to the positive birth stories of people who have had good, happy birth experiences, your confidence about the whole process will also improve. And the last point is, after you've listened to a lot of positive birth stories, make sure that you again educate yourself about what labor and all the process is and keep practicing. And for doing the practice, it is also important that you join a child birth class or what is called the prenatal class, because here when you are in a calm and relaxed surrounding, we will teach you about different kind of breathing techniques, hypnobirthing, coping techniques, exercise during pregnancy, what nutrition is important during pregnancy, in the labor, and also about your postnatal breastfeeding, and so many other things will be taught to you. So it is so important that if you have learnt about the breathing techniques in pregnancy, you don't have to just do it on the day of your labor. You have to keep doing it and keep practicing it throughout the pregnancy so that you are well equipped with all tools and resources to have the kind of birth that you wish for. So all the best, my dear girls, and do take care.